morning. Can all members participating online please turn your cameras on to be counted for quorum?
So good morning, everyone. The board secretary, my name is Councillor Chris Moyes, and I am the chair of the Board of Health. The board secretary has confirmed that we have quorum, so I'll call meeting 25 of the Board of Health to order. Today's meeting is being held by video conference and in person at City Hall in Committee Room 2, not Committee Room 1, where I was earlier. Because we are meeting in person and remotely, we ask everyone for their patience with any delays and technical issues. If you are registered to speak at today's meeting, please listen for me to call your name. I will call speakers in the order they appear on the list. The list of speakers can be viewed online by visiting the Board of Health page at toronto.ca/council and clicking the speakers box for today's meeting. The board secretary has provided all agenda materials on toronto.ca/council and via CMP, the clerk's meeting portal. Directors, please ensure that your video is turned on. Please keep your mic muted unless you wish to question staff or speak on an item. As part of each agenda item, I will ask directors to raise their hand or unmute their mic if they wish to question staff or speak. I will then create a speakers list and will call on directors when it is their turn to speak. Okay. When voting on an item or a motion, can everybody hear me? Okay. When voting on an item or a motion, I ask the directors ensure that they turn on their video and to raise their hand to indicate their vote. Directors, I want to remind you that you must submit and approve your motions by email. Staff are available at boh@toronto.ca to help with motions. And in the room, we have Councillor Chang, Councillor Bravo, and Director Chandrabalan. Online, we have Councillor Thompson. Can't see the names. Director Suman Roy, Brady, and Director Uzade. Thank you. And Councillor Peretz is also with us. The Board of Health acknowledges the land we are meeting on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. The City of Toronto acknowledges all treaty peoples, including those who came to here as settlers, as migrants, either in this generation or in generations past, and those of us who came here involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. We pay tribute to those ancestors of African origin and descent. Are there any declarations of interest under the Municipal Conflict of Interest Act? If you have an interest, please raise your hand or unmute your mic and indicate the item, number, and the nature of the interest. Director Roy?
25.3. An organization I'm associated with has received funding under that, so I wanted to declare that interest.
Okay. We'll take note of that. Next, we need a motion to confirm the minutes from our last board meeting on May 25th, 2025. Councillor Bravo moved. All those in favor? Opposed? Carried. So welcome to our June Board of Health meeting and happy Pride Month to everyone. As we celebrate the diversity, vibrancy, and accomplishments of the 2S LGBTQ community, this month is also an opportunity to highlight the work ahead to foster greater inclusivity and equity in all realms of our society. Public health plays an important role in realizing these goals. At the population level, preventing HIV/AIDS remains a priority. While HIV/AIDS activism began in the 2S LGBTQ plus community, we know that the advances we've fought for have had far-reaching impacts. We've come a long way since the 80s, when tireless activists like Larry Kramer stood up to demand action from governments and raise awareness about this devastating disease. But the prevalence of new HIV diagnoses in Canada is still rising. I'm pleased that today we will be confirming the 2025 Toronto Urban Health Fund allocations for new and continuing projects, several of which focus on HIV/AIDS prevention. June is also recognized as National Indigenous History Month here in Canada. It is an opportunity to learn about the unique cultures, traditions, and experiences of First Nations, Inuit, and Métis peoples who have lived on this land since the immemorial. Amidst this rich history are traditional practices in health and well-being that are still used today. I would like to extend my congratulations to Anishinaabe Health Toronto, who this week will celebrate their grand opening of their Indigenous Health Hub on Cherry Street, a new home to continue serving Indigenous clients through both traditional and Western approaches to care. We have a relatively light agenda ahead of us today, but the items we'll be discussing address timely public health issues. As we touched on briefly last month, there has been a concerning rise of measles cases across the province, largely in the southwestern region. As of June 2nd, there have been seven laboratory-confirmed cases of measles reported in Toronto in 2025. For context, the 5-year pre-pandemic average was 5 measles cases annually. Today, Toronto Public Health will share a presentation about their ongoing work to prevent the spread of measles in Toronto. We have also before us a report on the Downtown Homelessness and Addiction Recovery Treatment Hub to follow up on a request I made in April for an update on the interim and permanent HART hub models, as well as the comprehensive case management plan. And finally, I'd like to provide an update on the Medical Office of Health hiring process. We had expected to bring a recommendation to this meeting of the Board of Health. However, we are still wrapping up the process and plan to bring forward a recommendation in July. Over the past couple of months, the hiring panel have worked with Phelps Group to identify candidates and conduct a first round of interviews. We are proceeding with a second round of interviews next week, from which I am hopeful a successful candidate will emerge. I'd like to thank my colleagues, Councillor Bravo, Director Chandrabalan, and Dr. Zhao for their commitment to this process. And with that, I will pass it over to Dr. Lamptey.
Good morning, Chair Moyes, members of the Board of Health, and to everyone who is joining us today in person and online. Before we look ahead, I think back to this past month and the many events and activities that have taken place since we last met. On May 15th, the City of Toronto held the 2025 Toronto Community Champion Awards to recognize individuals and community organizations across our city who contribute to the health, well-being, and quality of life of Toronto residents, particularly those from Indigenous, Black, and other equity-deserving communities. Toronto Public Health was proud to be part of the selection committee that invited residents to nominate organizations that have made a meaningful impact on their lives. From May 12th to 18th, we joined others across Canada in celebrating National Nursing Week. This year's theme, The Power of Nurses to Transform Health, highlighted the incredible impact nurses have in shaping healthcare, driving innovation, and advocating for patient-centered care. Thank you to the 450 nurses at Toronto Public Health for their commitment, compassion, and dedication. Last Wednesday, we celebrated the 11th annual Toronto Newcomers Day at Nathan Phillips Square. Our dental health, reproductive and early years, sexual health promotion, and tuberculosis teams were on site to connect directly with the community and share valuable public health information and resources with our diverse community members. Measles resources were also available in multiple languages. Just yesterday, the city officially marked the start of Pride Month in June. Toronto Public Health is proud to support our Two-Spirit LGBTQ+ communities in Toronto. From June 27th to 29th, we will be part of the Toronto Pride Street Fair. Our team will provide sexual health information, Mpox vaccination guidance, harm reduction supplies, and inclusive health resources that demonstrate our commitment to providing accessible health services, promotion, and advice to all. Our staff are hard at work at supporting Toronto school communities. As another school year comes to an end, this is a good time to remind everyone about the importance of routine school-based vaccinations. This year in Ontario, measles has been spreading at high levels, mainly among children who are unvaccinated. Many children, unfortunately, have gotten quite sick from this serious and highly communicable contagious disease. We urge students who are not up to date with their measles vaccines and other vaccinations to get caught up as soon as they can, and we ask that their parents report their updated vaccination status to Toronto Public Health. Measles vaccination provide more than 95% protection against the virus. It is the most effective way to limit the spread of the virus and to protect yourself and your loved ones. This month, many high school students across the city will be celebrating prom, graduation, and other year-end events. To promote safer celebrations as our youth mark these special milestones, our school health team is sharing safer partying resources to highlight the risks of substance use. Protecting our population from the impacts of substance use is one of our vital roles in Toronto Public Health, and harm reduction remains a cornerstone of our public health work. Our support of individuals who are experiencing the impacts of substance use and mental health issues is steadfast, and we do this through outreach and client-focused services such as naloxone training that is available in multiple languages to reach people who can benefit from these life-saving skills and resources. So June promises to be a busy month for the city and Toronto Public Health. Again, many thanks to our committed team for all they do every day to keep everyone who lives, works, studies, and plays in our beautiful city, and all our visitors from near and far, safer and healthier as they enjoy what Toronto has to offer. I wish you all a good month and a wonderful start to summer.
Thank you, Dr. Lamptey. I was told we have another declaration of interest to address. Yes, Director Krishmer, I was told you have a declaration. Do you want to declare it now?
Declaring conflict of interest for the Toronto Urban Health Fund item.
Okay. What's the nature of the interest?
Our organization is in contract negotiations, and I have a long-standing connection to this particular fund and a bias.
Okay, thank you. Okay, so we'll move on. Before I do the rundown, I'd like to add an item to the agenda. Staff, do you need to display it, or? It's about creating an independent website for Toronto Public Health. I've recently learned that Ottawa has one, and I think Toronto could benefit from something similar. So I'm asking for the feasibility of that. So all those in favor of adding this item? Opposed? Carried. Thank you. The first item is HL 25.1, Toronto Public Health. There's a staff presentation, and there are registered speakers on this item, so I will hold down. Item number 2, Downtown Homelessness Addiction Recovery and Treatment HART Hub. I will hold this item down. Item HL 25.3, 2025 Toronto Urban Health Fund Allocations and Review Processes. That will be held by Councillor Chang. I know who you are. How could I forget? The next item is HL 25.4, establishing the City of Toronto's Mayor's Awards for Artificial Intelligence, innovation within the city divisions, agencies, and boards. Councillor Bravo would like to hold that item down. Okay, so. For the new item I just added, anyone want to hold it down? No? Okay, so I'll move that. All those in favor? Opposed? Carried. Wonderful. I'm going to request that we reorder the agenda and perhaps move item 2, the HART Hub item, to the last item, because I do believe that some of the questions that will be asked, correct? Funding. It's confidential information, so I'm just going to move it to the last item so that, when we clear the room, people don't have to come back. Okay. So we'll go back to the top of the agenda. So HL 25.1, Toronto Public Health Response to the Ontario Measles Outbreak. Director.
Thank you, Councillor Moise.
I need coffee this morning. Not any. Go ahead.
I'm very pleased to introduce my colleagues, Dr. Alison Christ and Dr. Vinaya Dubé, Associate Medical Officers of Health at Toronto Public Health, who will begin our first item with a presentation on measles response in Toronto.
Thank you, Dr. Lamptey. Confirming if you can hear me. Okay. So we're here to speak about the Toronto Public Health response to the Ontario measles outbreak. Next slide, please. Measles is a viral illness that spreads through the air, causing a red rash, fever, cough, red watery eyes, and tiredness. Complications can be life-threatening. It is highly contagious. One infected person can infect 9 out of 10 unvaccinated close contacts. Through vaccination, measles has been considered eliminated in Canada since 1998, nearly 25 years, a quarter of a century. Measles elimination is reached when a virus is no longer endemic or circulating regularly in a geographic area in a certain country or region. A single-dose schedule of vaccine was introduced to all provincial and territorial routine immunization programs by the early 1970s. The routine one-dose MMR combination vaccine was introduced between 1974 and 1983. The routine two-dose MMR vaccine was implemented nationally in 1996 to 1997. In these years, catch-up campaigns were provided to school-age children to offer them a second dose of a measles-containing vaccine. Since the introduction of the measles vaccine in Canada, measles cases have decreased by more than 99% in that 25-year period. However, as cases in Canada rise, our Chief Public Health Officer, Dr. Theresa Tam, has stated that if cases extend beyond October, the country will lose its measles elimination status and the virus will be considered endemic. This means the virus will continue to circulate domestically in Canada. This means if sustained transmission continues until October, the Pan American Health Organization will revoke the elimination status from Canada. Next slide. On October 18, 2024, exposure to a travel-related case in New Brunswick led to measles cases increasing in Ontario. Ontario, as a result, has seen a significant increase from the pre-pandemic average, the years of 2015 to 2019, of 11 cases per year in Ontario. During this outbreak, Ontario has commonly reported more measles cases per week than it was used to seeing in an entire decade. The outbreak is largely impacting those who are not vaccinated. To date, Toronto has not had outbreak-linked cases. Prior to the pandemic, the 5-year average between 2015 to 2019 was 5 cases a year in the City of Toronto. In 2024, there were 10 confirmed measles cases in Toronto. To date, we've had 7 confirmed cases in 2025. It's imperative that we stay committed to Toronto's planning and response, including vaccination, as the risk continues in our neighboring areas. Next slide. So responding to measles cases requires action beyond our case count of confirmed cases. Toronto Public Health has mobilized staff from across the division to respond to measles. The number of confirmed cases, that number of 7 in 2025, does not fully capture the scope of the public health case and contact management response. TPH is investigating more possible or suspect cases than before this outbreak. Toronto Public Health has investigated 152 suspect cases in 2025 so far. Each suspected case results in a significant amount of investigative work to rule this case in or out. Toronto Public Health has also followed up on several outbreak-related case exposures from visitors to Toronto. These exposures have resulted in follow-up of hundreds of contacts and media releases. Toronto Public Health has completed contact follow-up for almost 1,000 individuals in the year of 2025 to date. So far, in 2025, this has cost $750,000 for the measles response team, and this will continue to grow as we have increased the number of staff to respond to this measles situation, shifting resources from other parts of the organization. This is in addition to the ongoing resources spent on measles, including resources on the Immunization of School Pupils Act assessment program and other activities. There are broad health system impacts, including increased demand and need for testing, and this is an impact on primary care practitioners, and increased exposures, resulting in case and contact management in hospital and acute care settings, specifically emergency departments. Next slide. As a part of contact management, a measles exposure can cause an unvaccinated individual to be excluded from settings, including schools and childcare centers. Vaccination records of each contact are verified during contact management, and exclusions can then apply in the setting of schools, daycares, camps, and other healthcare settings. Here's an example about a school exposure. A student's measles vaccination record must be reported to their local public health unit. This facilitates contact management in the event a case is identified in that school setting. Exclusions can last up to 21 days from the last exposure in the school setting, which means it's possible with potentially multiple exposures that an unvaccinated individual could be excluded for longer than 21 days. Some schools in southwestern Ontario at this point in the provincial outbreak have been closed due to measles exposures, which is a result of lack of vaccination records for staff at those schools and prohibits the school from being able to operate. Even with those exemptions, even those with exemptions could be excluded in the event of an exposure in these settings if they're not vaccinated. Next slide. What is TPH doing to prevent local transmission with the current increased risk in Ontario? Toronto Public Health has been responding to the increased risk of measles through a number of key activities. Communication, promoting measles and vaccination messages through Toronto Public Health programs. The Immunization of School Pupils Act vaccine assessment program. We've completed full immunization assessment for students born in 2008 and 2016. This process provides an understanding of the level of protection from measles and other vaccine-preventable diseases in our community. Toronto Public Health is sending individualized measles letters to all students without complete measles vaccination records in June of 2025. This is an approximate 140,000 students. Toronto Public Health has added vaccine clinic appointments for students as a secondary vaccine channel and collaborating with healthcare providers to promote vaccination through this primary vaccine administration channel. It's important to note that primary care is the primary channel for measles vaccination, and the Toronto Public Health clinics are an additional opportunity for students in Toronto. Next slide.
The measles vaccine recommendations for Toronto residents has not changed routinely for those living in Toronto. So the routine vaccination schedule includes on or after a first birthday, a child receives their first dose, typically as the MMR vaccine, and they get a second dose at 4 to 6 years of age. For adults who are born before 1970, they're generally considered protected and don't need any ongoing vaccinations. If an adult is born in 1970 or later, the recommendation is that they receive 2 doses of the MMR vaccine. If an adult born in 1970 or later is unsure about their vaccination status, they can certainly go ahead and receive the vaccine and get 2 doses in discussion with their primary care provider. Now, Ontario has updated their recommendations for those living in southwestern Ontario to provide earlier vaccination doses for children who are 6 to 11 months of age. For Toronto residents, we have had an ongoing recommendation for infants who are traveling to areas where measles are circulating that they can get an early extra dose. And the change now is that if an infant is traveling to southwestern Ontario, that would be an area where measles is spreading and they could get that early dose. In addition, a toddler who may be traveling to southwestern Ontario or to other parts of the world where measles is spreading could get their second dose earlier. Next slide, please. Due to the pandemic, we've discussed many times with the board that our vaccination rates have decreased as a result. These are our measles vaccination rates from Public Health Ontario for the City of Toronto. And you can see that top line is our vaccination rates for 17 years olds, and you can see that it has been quite steady and was not very much disrupted through the pandemic because they were mostly already caught up when the pandemic hit. And so their rates are above 85%. That bottom line that's a bit faint are our vaccination rates for those who are 7 years of age. And in the 2023-2024 school year, those rates were 69%. So those rates have fallen. We know that many of the reasons why those rates have fallen were because children didn't have access to primary care. There were limited in-person visits. Now it's required a catch-up. But we also know that vaccine hesitancy and vaccine confidence is also playing into getting children caught up with their routine vaccinations. Next slide, please. We have continued with our ISPA Immunization School Pupil Act assessments, and we do know that these assessments that can suspend students if they are not up to date with their vaccinations or have a valid exemption can result in very high vaccination coverage rates. So beginning in 2025, we have assessed students who are in grade 11 born in the 2008. It assessed their vaccinations or exemptions in accordance with the ISPA. And when we started this process in January, only 23% of students were up to date according to Toronto Public Health's records. And as a result of this assessment, assessing over 24,000 students, we now have 87% of students in this cohort who are caught up, which is a 64% increase in a few months. And another 7.5% of students have begun their vaccinations process as well. Next slide, please. In order to address this large increase in measles in Ontario, Toronto Public Health is also doing an additional letter that is going to begin this week to all students who attend Toronto Public Schools, which is 140,000 students who have incomplete measles vaccination records with Toronto Public Health. They will receive a personalized letter to their home making them aware that that child is not up to date with their vaccinations, urging them to get vaccinated and to report their vaccinations directly to Toronto Public Health. Next slide, please. We also have had a number of public communications campaigns and strategies to increase our presence and communications related to measles and the outbreak. And this includes infographics and social media messaging on knowing the signs and symptoms of measles, on vaccine hesitancy and vaccine eligibility and reporting. We've also had some additional strategic communication activities, including news releases, proactive media engagement, updating our website, including a page that has our local exposure listings where you could have been exposed to someone who was contagious with measles. We have a strong physician engagement communication tools, social media and digital ads, community partner toolkits, and a school letter campaign that I have discussed. Next slide, please. There are certainly challenges, of course, related to our ability to respond. And we have certainly noticed that we do need to increase vaccine confidence. Vaccine-related misinformation and disinformation is undoubtedly impacting vaccine confidence and ultimately our vaccination rates. And we certainly need our vaccination rates as high as we can achieve in order to prevent single cases spreading into outbreaks. We have insufficient data on parents and caregivers' intention to vaccinate their children with routine vaccines, including school-age vaccines, and to understand what specifically our Toronto and Ontario parents have for this hesitancy. We also have outdated technological solutions impacting our public health unit's ability to enforce the Immunization School Pupils Act and to do case and contact management. So for example, we lack a system that can be used by healthcare providers and all health units that will allow for easier and improved reporting, like a provincial and electronic registry for all vaccines, and we lack consolidated medical records to conduct case and contact management and prevent the spread of measles in a more seamless way. And with that, I will turn it back to you, Chair.
Thank you, Dr. Dubé, and thank you, Dr. Chris. We do have speakers in this item, so we'll hear from them before we take it into in-house. So first on my list is Heather Pun. Are you here online?
Hello?
You can hear you. 5 minutes. Go ahead.
Great, thank you. The start of this school year came and went with little guidance from TPH about how to protect against airborne infectious diseases. In November, we wrote a letter to TDSB trustees asking that they request TPH to provide more robust information on airborne disease transmission and protection. In response, TPH sent an info letter to the school boards and a respiratory virus digital toolkit that contains 2 new infographics that included the importance of masking, ventilation, and filtration, but they have not been promoted. Many schools only shared them because members of our group phoned our principals and trustees directly. Neither of these new graphics have been shared by TPH on social media. I cannot understand why. The most recent measles communication package was shared to school principals on February 21st, just 2 weeks prior to March break. The direction in the letter by Dr. Finkelstein to principals was to promote this important information to the school community and on social media channels before the March break school closure. In many cases, the info was sent out by schools in the last week before the break. At my child's elementary school, where the grade 2 cohort MMR vaccination coverage is a mere 45%, I had to ask the principal to share them as he missed the initial emails. Asking people to get measles vaccines only days prior to planned vacations isn't protecting their health. It's panic-induced risk management for measles that was already spreading in Ontario, merely a car ride away. The sharing of public health guidance should not be optional. It should be centrally distributed with supplemental information required to be shared by schools. There is still no info on layers of prevention, only a focus on vaccination, and there has been nothing to schools since the March break communications. Most families are unaware there is a measles outbreak at all. They certainly don't know that MMR vaccination rates are as low as 45% in some schools. People want and need full information to protect their health. It's part of your strategic plan and expected. Flood the schools with information on the dangers of measles and other airborne infectious diseases, as well as the impending risk of wildfire smoke. So many of the ailments our children are encountering are preventable, but the guidance around how to prevent is lacking. Parents like myself have been advocating to Toronto Public Health for respirators, ventilation and filtration, and education of long COVID since early in the pandemic. More than 5 years has passed, and I am still waiting for my child's school board, public health, and hospitals to catch up to the science. It is unconscionable that we have the information to better protect, but public health and our governments are choosing not to share it widely. I would also like to mention that masking needs to be normalized to contain the spread of all infectious diseases. And quite honestly, this starts right at public health. From the prior MOH posting pictures getting vaccination while unmasked to the vaccinators at my child's middle school, all but one unmasked, representation matters. To be the only child in a school of over 500 masked and following TPH guidelines to mask in crowded indoor spaces with poor ventilation, the very definition of a school, and to receive their vaccines from TPH staff that are unmasked does not support my child or the stated Toronto Public Health guidance. It's increasingly difficult for someone of her age to continue to protect herself given the peer pressure to unmask. Adults can't even manage. Many parents have said that their children stopped masking not because they couldn't, but because no one else, peers or teachers, were. She has her second round of 7th grade vaccinations tomorrow, and I hope that Toronto Public Health will show leadership, follow their own guidance, and demonstrate community care by ensuring that all vaccinators are masked with high quality, tight-fitting respirators like your guidance suggests for crowded indoor spaces like schools. You have no idea who is vulnerable in those buildings. The current Board of Health meeting is not accessible to vulnerable people because masks are not required and no one wears them. Hospitals and healthcare are no different. People are avoiding care because these essential spaces are not safe. We are no longer all in this together. Go to Sick Kids one day and see the lack of masking despite vulnerable babies and children unable to mask or protect themselves through vaccination. Do you think parents are purposely putting their children at risk, or have they not been provided the knowledge by those in charge? How do you expect the people to follow your guidance when you and other healthcare workers do not follow it yourselves? Anytime someone in a leadership role is given the opportunity to normalize masking, you should be doing it, whether you think it's a high-risk space or not. It may mean that others that report to you now feel comfortable wearing a mask too. It may mean that someone will don a mask to protect their health because they do not feel so alone in a sea of maskless people. It makes spaces more accessible to high-risk people, the very voices Toronto Public Health should be listening to. Your guidelines actually say that masking continues to be an important layer of protection to keep you, your loved ones, and the most vulnerable in our community safe. Wearing a mask, in addition to other public health measures, can reduce the spread of these viruses and is an important measure we can use to protect ourselves and one another. To have these guidelines and not follow them erodes trust and makes it difficult for those that need to mask and those that want to continue to mask to keep themselves safe. Vax up,
5
mask
seconds.
up, encourage ventilation and filtration to ensure that all Torontonians are safe in the spaces that they live, work, and play.
Thank you.
Thank you.
Any questions for the Deputy? Seeing none, thank you for coming in today. Avery Bryce, are you here? Online? Avery, we can see you. Can you hear us?
Yes, we can. Thank you.
Okay, go ahead. 5 minutes. Go ahead.
Good morning. My name is Avery and I'm 12 years old. Right now, I should be on a school bus with my classmates going to a grade 6 school trip. But no, I'm stuck here talking to you about why you should ask the public to mask or at least install HEPA filters in public places like hospitals or schools. I'm so angry right now because there was this fun overnight sleepover that I have to miss because I got COVID for the first time and I can't go. I'm mad that I couldn't go on this trip, but I'm infuriated that whoever had COVID first came out in public and it just happened to be me to catch it. Why I'm mad is because I live in a family that masks regularly and I'm the only 1 out of 4 people in my entire school who mask. Out of all 546 kids who don't wear a mask, I'm the one who gets sick. That's really unfair. I don't want other people to get sick, but I'm just confused why it had to be me. I just hate when other people are selfish or don't know enough to come to school or work when they're sick. What I'm asking for you today is that you announce to people the information they need to know to keep themselves safe or others safe too. Thank you.
Thank you, Avery. That's very brave of you to come and depute today. Any questions for Avery? Thank you, Avery. I hope you feel better soon. Next up is Kelly McIntosh.
Good morning.
Okay, 5 minutes. Go ahead.
During an active outbreak of measles, a disease which our previous speaker mentioned was declared eliminated in 1998, the ongoing COVID pandemic and the threat of avian flu on the near-term horizon, I'm here to request that the Board of Health instruct Toronto Public Health to proactively educate the public on the serious risks of airborne infections and the importance of clean indoor air to mitigate those risks. The previous speaker is my daughter. I can't tell you how proud I am of her that she asked if she could depute to you today. I also can't express just how furious I am that she, and now me, is homesick with COVID for the first time after 5 years of consistent masking instead of being on her class trip. She started a new school this year, so had to depend on others to show her around and tell her where to go. At this very moment, her classmates are all arriving at the camp she has attended in previous summers, and so the roles were going to be reversed. She, who, despite her great presentation this morning, can be somewhat reserved, she was going to get to be the leader, showing her classmates the ropes. My concerns for her long-term health aside, the loss of this leadership opportunity is heartbreaking to me. And why is she missing out? Because someone thought it was okay to send their sick child to school. Why did the parent make that choice? Because public health has not taught them that every COVID infection is causing invisible damage, how dangerous a measles infection can be. These parents don't know that they should be wary of COVID or measles for the same reasons they don't know how to protect themselves from COVID, for the same reason they don't know how to protect themselves from measles. TPH's current strategy to reduce transmission of airborne infections like measles and COVID appears to be entirely focused on vaccination. And that is not enough. This vacuum of information creates a space for mis- and disinformation to spread. We are seeing this happen in real time with the growth in anti-vax and anti-mask sentiment. As a parent, I am particularly concerned how this poor information sharing impacts children. Since children are mandated to attend school, and schools are the work environment for education staff, the lack of protection from airborne diseases and indoor air pollution may be viewed as an occupational exposure that can have serious, long-term consequences on their health. To borrow from Ontario School Safety, we need to employ a vaccine plus strategy of promoting vaccination, but also mandating an indoor air quality policy for public spaces, educating the public about using tools like ventilation and filtration to ensure clean indoor air, using CO2 monitoring in public spaces so we can assess how safe the air is, and yes, explaining the effectiveness of wearing high-quality, well-fitted masks. Community health is not achievable on an individual level. I will continue to wear my respirator in public, and so will Avery, but I can't end this measles outbreak or the COVID pandemic on my own. Information empowers us to make healthy choices. Therefore, I ask TPH to take these 3 steps. 1, run an extensive public education campaign on the dangers of measles and COVID, on how air pollutants and airborne infectious diseases are so harmful, and on how to clean the air we breathe with easily available tools like masking, ventilation, and air filtration. 2, advocate for the City of Toronto to adopt an indoor air quality policy for all indoor spaces, not just where municipal employees work, and for masking to be mandatory at least in healthcare spaces. 3, publish guidelines on what constitutes clean, safe to breathe air, and publicly monitor the CO2 concentrations of public indoor spaces. Educate, advocate, publish clean air standards and tools. Thank you.
Thank you very much. Any questions with Deputant? Seeing none. Thank you for coming in today. Thank you.
Thank you.
Next up is Natalia Kondratieva. There you go. You have 5 minutes. Go ahead.
Toronto Public Health regarding its response to the Ontario measles outbreak. To put it bluntly, everything I see from TPH's current response is woefully inadequate. However, with proper dialogue and planning, there's a huge opportunity to put Toronto back on the map as not just a national, but also as a global leader of infection control and prevention. I am here today as a private individual carrying on full-time employment as an HVAC building automation technician for a major systems integrator in Toronto. And we serve pretty much all major Toronto hospitals. I work with other technicians, building operators, and mechanics who have already repeatedly caught COVID through our line of work. It has become clear to me that through my day-to-day employment, the understanding of airborne disease transmission is still quite weak, even in healthcare settings. Now, the people I work with, they are quite used to the concept of airborne particulates, but airborne disease transmission is a little bit new. I have to take it on myself to educate these coworkers, customers, and contractors about what is now framed as a personal decision to mask during an ongoing COVID pandemic. And as a newcomer to a male-dominated trades field, I have spent countless hours explaining how the filter material used in my N95 respirators is similar to the HEPA filters used in HVAC systems or air purifiers. One of these filters supplies fresh, clean air to a single set of lungs, while another supplies clean air to a room. For some reason, this basic understanding continues to be lost on the large majority of people I interact with in Toronto. A vaccine-only approach does little to protect the majority under-vaccinated youth population with little existing trust in public health or science when it comes to measles. Most importantly, future generations are being kept in the dark about the benefits of monitoring and controlling their indoor air quality. I would like to take this moment to remind TPH that air, just like water, is an essential resource where the average person breathes thousands of liters a day. In the field, I see readily available N95s at major hospitals, but I almost never see them worn. I sometimes see signage about masks being recommended, but unfortunately, I see a lot more signage about hand washing. Measles, just like COVID, is airborne. Hospital employees, patients, visitors, and contractors deserve to be warned about the hazard we know is currently present in our community. The public deserves to know that times have changed from elimination to what is now uncontrolled spread due to insufficient record keeping. TPH launching an indoor air quality improvement initiative would be an immediate, actionable, and noticeable step in alerting the public that our existing ways of managing indoor air quality are outdated. As admitted during today's meeting, our environment has truly significantly changed from total elimination to missing records and knowledge gaps. Leadership requires innovation and adaptation to this changing environment. I believe that capital upgrades in ventilation and filtration systems in high-risk settings, such as daycares and schools, is critical at this moment in time. And we also know it's not about just purchasing and procurement either. We need to include actual usage. We should be modeling this usage, judgment-free, to everyone. I've firsthand seen and heard far too many cases of purifiers being off in occupied spaces when they could be the most useful. I've also given out many respirators to people who support me in theory, but then feel ashamed to put them on when you start entering critical areas where they're either interacting with patients or are going to be exposed to a high airborne risk. This is bizarre to me because there should be no shame or stigma when it comes to protecting our health. The good news is that building automation systems minimize these user errors by automatically controlling based on direct field measurements. Toronto hospitals already have such systems in place. CO2 sensors are cheap and excellent in validating the effectiveness of fresh air supply to occupied spaces. System trends from these building automation systems are also able to reveal problematic areas for investigation and remediation. And I'm quite excited to be working in an industry that has direct implications for public health, as long as TPH does its part to protect my coworkers and community. An impressive building automation system can only go so far when most building operators still do not understand the public health implications of their day-to-day work. To conclude, I implore TPH that is beholden to protecting not just the largest city in all of Canada, but also all other public health units that depend on this world-renowned city's leadership in preventing the spread of disease. We have the tools and technology to dampen the spread of preventable airborne transmission, measles or otherwise. We don't need endemic measles, we need clean air and leadership.
Thank you. Any questions for the deputant? Seeing none. Thanks for coming in today. Next up is Sam Kaufman. Are you here? Sam Kaufman, online. Okay, you have 5 minutes. Go ahead.
Thanks. This presentation today from the board reveals that TPH's main response to the current measles outbreak is mostly to encourage vaccination. While vaccination to control measles is extremely important, as it's led to the elimination of the disease in the past, it's not the only necessary strategy. First, because in the current outbreak and in any major outbreak, there's a lot of virus around. So even a very effective vaccine like a measles vaccine will not completely prevent infection. This can lead to significant numbers of fully vaccinated people becoming infected. For example, in Public Health Ontario's current statistics on the current outbreak, you see that about 15% of known cases aged 20 to 39, that's about 50 people, had 2 vaccine doses. Now I'm guessing, but these are probably parents of infected children or perhaps caregivers or teachers who might be exposed to very high infectious doses. Second, even if we vaccinated everybody, there'd still be people left with little protection. The elderly, the very young who haven't been immunized yet, and the immunocompromised. And in reality, there will still always be some people who, for whatever reason, choose to remain unvaccinated. So if overall levels remain low enough for outbreaks to continue, these people will always be vulnerable. That means that additional measures to control transmission are necessary, measures that reduce exposure to the virus. Now, myself and many others here today, including members of Clean Indoor Air Toronto and Ontario School Safety, have been asking for some time now for TPH to create a strategy to reduce airborne disease transmission. Measles is universally acknowledged to be transmitted by air. It has been for decades. There are many documented cases of the virus remaining infectious in the air for hours after an infected person leaves a space and going on to infect others. But you'd be hard-pressed to find any measures to control airborne disease transmission in most places in Ontario, even in places frequented by the most vulnerable. Currently, there's very poor control of airborne infection risk in many medical facilities across the provinces. Hospitals have good HVAC, and in theory, they should be doing something. But if you look at most doctors' offices, most dental offices, most medical labs, these places do very little to control spread. They usually don't have good ventilation in their treatment and waiting areas, and they don't even use cheap but effective measures like portable air cleaners. So a clean air strategy could start with these places where ill people are likely to go and vulnerable people are likely to meet them. TPH could advise on or require ventilation and filtration standards for these places. Similarly, long-term care facilities, seniors' residences, and childcare facilities have no rules or requirements to clean the air for their residences. A TPH clean air strategy could help protect these vulnerable populations, our youngest and our oldest, in places where they congregate and spend most of their time. Currently, our public schools have no indoor air quality standards. While some boards have installed MERV 13 air filters in the buildings for the COVID pandemic, the Toronto District School Board has not. The HEPA units they bought for each classroom early in the pandemic are underpowered, they're too noisy for regular use, and in most cases, they're not even turned on. Many schools are overcrowded. Many rely on portable classrooms, and portables, as a rule, are poorly ventilated. A TPH clean air strategy could provide guidance and require that targets for filtration and ventilation are met in public schools. And I want to really stress, TPH does not need to limit itself to providing advice. TPH does much more than that when you think about how it deals with food safety. TPH could require compliance using the powers of the Health Protection and Promotion Act, fulfilling requirements of the Ontario Public Health Standards to protect the population from health hazards. These standards explicitly include jurisdiction over schools, despite what you might be hearing from other people. I implore all board members to read the Act and read the standards. Poor indoor air quality is a health hazard. It should be treated as one, and it's Toronto Public Health's duty to mitigate health hazards where they exist. So these steps should be part of a long-term strategy. Hopefully the measles outbreak will wane, but another outbreak may not be far behind, and we're still seeing too much serious illness, like long COVID resulting from ongoing COVID infections. It's far past time for simple measures to clean the air to be adopted universally in Toronto. And if public health isn't going to make it happen, it's hard to see who will. Thanks.
Thank you. Any questions for the Deputant? Seeing none, thank you.
Mr. Chair.
Yes?
Councillor Thompson, I had my hand up for a question for the Deputant. I don't know if he's still available. Looks like he is.
He's there. Go ahead.
Thank you, Mr. Chair, and through you to Mr. Kaufman. Mr. Kaufman, good morning, and thank you for your presentation, sir. I get the focus on public health and the clean air strategy as you've described it. But I'm just wondering, with respect to a more long-term approach, do you think that planning and our buildings department also have a role to play?
I would think so, yeah, absolutely. But we don't build, we're not building that many new schools, right? I mean, we have a ton of existing buildings, right?
Yeah, no, I get that. But also through that process, we can put policies in place. So it's not just the focus on public health. I mean, obviously, they're going to have to do some of the things that you've suggested, but I think it is not just reliance on them exclusively. And I just wanted to get your thoughts on that. But I think you have expressed that.
Well, there are standards that have been provided by the American ASHRAE, American Society of Heating and Refrigeration, and blah, 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 for all sorts of buildings to control infectious diseases. There was a standard released a couple of years ago that provides very good recommendations for all sorts of buildings. And I would love if those were incorporated into building codes in some ways. But I think the majority of people are spending time in existing buildings. So you need a strategy to assess that. Yeah.
Fair enough. Thank you. Thank you, Mr. Chair. Thank you, Mr. Kaufman.
Thank you. Next up is Lindsay Kneteman online. Lindsay, you here?
Can you hear me?
Yes, we can. 5 minutes. Go ahead.
All right. Great. My name is Lindsay, and I'm a resident of Ward 14, and I'm speaking today to plead with Toronto Public Health to take the actions needed to prevent a measles outbreak in our city. And to be blunt, given what I just saw in that earlier presentation, I feel I need to plead extra hard. Yes, the measles vaccine is a very safe, very effective, and frankly, miraculous product that has saved millions of lives over the past decades. And because of this, I highly support TPH's amplifications of its vaccination uptake initiatives. However, we need to be realistic about where the world is at right now. As much as I wish every eligible person would choose to be fully vaccinated, we know that's not going to happen. Per your own data, that decline in vaccination in 7-year-olds actually started several years before the pandemic. And while we've seen some uptake, which is great, the coverage is still far from where it should be, even with all the resources being pumped into that. And where that coverage should be is well over 90%, because we know that to achieve herd immunity against measles, we need a vaccination coverage rate of around 95%. And let's be stone cold honest about our situation. Toronto is not going to hit that 95 number, especially not in the next few weeks when we're at highest risk of an outbreak. So let's design a strategy for this moment in time, where we're just a couple unlucky incidences away from dozens or hundreds of measles cases in the city. And let I remind you, the mortality rate for children with measles is about 1 to 3 per 1,000. Earlier this spring, I came across Ontario School Safety's Vaccine Plus strategy for preventing the spread of measles. It proposes that in addition to vaccination, we improve indoor air quality, we normalize masking, we encourage more outdoor activities and other tactics. And these things are promoted, they're implemented. Many previous speakers have touched on these in far more detail. And these are tactics that we know, thanks to hard science, reduce the spread of airborne diseases, including measles, the most infectious airborne virus of them all. And I'm very disappointed to see that none of these tactics are even hinted on in that presentation. Though I will acknowledge that if you click in the right spots on the City of Toronto website, which by the way, yes, public health totally should have its own, if you click in the right spots, you will find some mentions of these non-vaccine interventions. Why is this information so hidden? Why not, in addition to efforts to increase vaccination, we have transit ads that teach people about the benefits of indoor air filtration and ventilation, or social media video that explains the physics of how a high-quality mask protects one's health. These are noisy times, and we need Toronto Public Health to be clearer and louder than the chaos that currently surrounds us. And it especially needs to be loud in our schools, as they are, of course, the most likely place for an outbreak. I have kids in the TDSB and have been told repeatedly it takes its guidance from you, so please provide provide the school with that guidance and explicitly educate staff on what they need to do to keep students and themselves safe and healthy. And then this information obviously needs to also be shared with families. As mentioned, the TDSB has not really mentioned measles since February, and since then, this virus has very much established itself in Ontario. But again, you wouldn't know that based on the TDSB's communications with parents. This is where we need Toronto Public Health to get in there and explain to families why they need to care about not getting measles and what they can do to stay healthy, vaccines and otherwise. And what I see unfolding before me makes me wish more now than ever that we had just not memory hold the COVID-19 pandemic, that we'd implemented the many lessons learned from it, particularly around indoor air quality and public health communications, because as others have noted, this measles outbreak, it's not going to be the last of these challenges we face. Had we taken a path where we approached indoor air quality and other tactics with the maturity needed, Toronto would be in a much better position to avoid this current measles outbreak. Thankfully, I believe we still have time to implement a strategy that meets this moment for what it is and then shapes it into a success story in which Toronto does not experience the measles outbreak that we're seeing in other parts of the province. Thank you.
Thank you. Any questions for the deputant? Seeing none, thanks for coming in today, Lindsay. Louise Hidinger, are you here? Online?
Hi, can you hear me now?
We can. Go ahead, 5 minutes.
Okay, I have a presentation. Could you give me a moment to share my screen? Actually, I can't share my screen. I'm just going to speak. I'm a concerned parent and a member of Clean Indoor Air Toronto. I'm here to speak about the lack of information that Toronto Public Health has provided to the public, and especially the school community, regarding measles and how to protect against it. There's unfortunate parallels between COVID-19 and measles. Just as many believe COVID to be mild, many also think measles is just a rash that one can recover from. They don't realize it's a serious infection that can cause lifelong issues. They don't know that measles is actually a respiratory virus, and like COVID, it spreads primarily through the air. And this is because Ontario's public health units, including TPH, have not informed the public of the seriousness of COVID-19 and now measles, that these diseases are transmitted through the air, and that vaccines are necessary, but they don't provide 100% protection. This past school year has illustrated this knowledge gap, as well as the dangerous lack of information from our public health units. The start of the school year came and went with little guidance from TPH about how to protect against airborne infectious diseases. A letter was sent 1 week after the start of school, and it made no mention of protective layers like masks or improving indoor air quality. So in November, members of our group sent a letter to the trustees asking that they request TPH provide more robust information. In response, in January, TPH sent a letter to the school boards with a digital toolkit which contained 2 new infographics on how respiratory viruses spread and 4 steps for self-protection, including wearing a well-fitted mask, avoiding crowded spaces, and increasing ventilation. This is essential information that would be new to most members of the public. Unfortunately, these infographics were buried inside a file with a series of older infographics, ensuring that they'd be ignored. As a result, by the start of February, no schools had shared these infographics with their communities. We contacted TPH in February to highlight this problem and to ask that specific direction be sent to the schools, but this request was ignored. As far as we know at the present time, only a handful of schools have shared this information, and that's because parents in our group contacted school staff directly. This means that the vast majority of the TDSB community has not seen this information. Neither of these 2 new graphics have been shared by TPH on social media. Only 1 information package regarding measles was sent to the school boards in February, and it focused exclusively on encouraging families to get vaccinated before traveling. The imagery used suggests that only travel abroad is an issue. Since then, we've seen nothing. Now, we've been told that all of the information we need is found on TPH's website, but this website, it's difficult to navigate. I'm glad to hear that you're considering a separate website because that would help. The 2 new infographics that I spoke about, they're on the website, but they're hidden in a drop-down tab, buried 5 pages below the landing page, making them inaccessible. But more importantly, measles is not even listed as a respiratory infection. As a result, few people would know that the guidance on how to reduce the spread of respiratory viruses applies to measles. But the reality is that most people don't go looking on the website or even social media for public health information. They wait for that information to come from their school, their employer, or their family health team. These organizations depend on the information from TPH. If it isn't being supplied and it's not being broadcast widely, then people will continue to remain unaware. It shouldn't be up to parents to ask for public health information to be shared. In order to effectively contain the measles outbreak, we urge TPH to run a major public communications campaign to inform the public of the seriousness of measles and precautions against airborne transmission. We also ask that TPH use traditional communication methods so that the message isn't lost in a sea of misinformation on social media. And now, with wildfire smoke in our skies today, we also wish to remind you of the outstanding request for a report on ventilation that was requested 3 years ago. We urge the Board of Health to request that TPH and municipal licensing and standards accelerate their completion of this long overdue report in order to develop a citywide indoor air quality policy. Such a policy would provide a much needed layer of protection, not just against the spread of airborne diseases like measles, but also make the city more climate resilient to harmful air pollution that's coming from climate change related events and man-made air pollution. Please give the public the tools and the information needed to protect themselves. Thank you.
Thank you. Any questions for the Deputant? Okay, seeing none. Thank you for coming in today. Next up is Mary Jo Nabuers. Are you here? Online? Okay, go ahead. You have 5 minutes. You're on mute.
Thank you. Ontario School Safety sent an open letter at the end of April of this year to members of the Ontario government and to Chief Medical Officer of Health, Dr. Kieran Moore, regarding measles spread. We are advocating for a vaccine plus strategy. Like your state, we state explicitly too that vaccination is the #1 way to protect oneself from measles. But we also know that while the public is slow to vaccinate, admitted by Dr. Moore, we can help slow the spread of this awful virus by deploying all the tools we have available to clean the air that anyone who enters a school setting or a school bus breathes in, because measles is airborne. Our measles letter is not the first letter our org has written to those mentioned above. In fact, it's not even the first measles letter, as we suggested the same to them last year. It's one of the thousands of communication attempts we've made over the years via different avenues. And when you look at the sum of our communication attempts, you will see that there are very few public health issues that improving our indoor air quality doesn't help with. Some that might seem obvious to you, and some you may not realize. Protection from the dangers of wildfire smoke, helping those with asthma, slowing the increased need for food pantries, as improving IAQ can help reduce chronic illness, which often leads to food and housing insecurity, increasing safety of kids on school buses. Drivers can suffer brain fog and sudden heart attacks and strokes the more they are infected with COVID-19, for example. Reducing the amount of aggressive behaviors in schools and in the general public, as improving IAQ will help reduce the contracting of ongoing viruses such as COVID-19, which is being shown to damage the area of the brain regulating behavior. Reducing the negative impacts of microplastics and volatile organic compounds, showing true inclusion for the disabled population. Supporting caregivers and reducing the number of children becoming caregivers for their adults, dealing with extreme heat, reducing virus spread like COVID-19, RSV, strep, influenza, tuberculosis, whooping cough, measles, the common cold, and many more. You know, in general, we know those working in public health like you have a genuine desire to do good things for the public. But I have to be honest, as an organization with our ear to the ground at this point, 6 years into an ongoing pandemic, and with the information and tools available regarding IAQ, it's really difficult to look at the continuous refusal of government and public health leaders to do better when it comes to indoor air quality. It's hard not to wonder about what it is that's holding you back from doing what's so clearly needed. You mentioned yourselves that Dr. Tam has expressed the risk we have of losing our elimination status regarding measles. Why are we not throwing everything at it then to stop that from happening? We can't understand why, if you go so far as to put some good IAQ information on your website, that you wouldn't also make sure it's communicated broadly beyond your website, especially when we know just how many aspects of our lives IAQ impacts and when very few people go to your website for public health advice. We can't understand how the measles mitigation efforts that are coming, which you described earlier in this meeting, include nothing about managing the air one breathes. So we're challenging you to two things. One, to do more, to show us that your mandate to protect the public's health is still fully intact by engaging with the many of us who have clearly done our homework and who continue to make ourselves available to you as additional resources to make things better. To show that you are not stuck in 2019 infectious disease prevention, but instead flexible and open to other well-supported mitigation techniques. And two, to come up with a solid and supporting reason that improving IAQ is not worth your time to embrace and invest in. If immediately you think that cost is the prohibitive issue, then we can discuss that too, because the reality is at this point in history, with increased climate events, more frequent pandemic threats and occurrences, people struggling more and more to fight off sicknesses they didn't used to struggle to beat, a strained and underfunded public healthcare system, and leaders south of us making changes that put us all at greater risk for poor public health outcomes, we cannot afford to see it as not worthy. As well, if cost is the first obstacle you see to embracing the need for better indoor air quality, then perhaps we can ask the Toronto municipal buildings, courts, the Ontario legislature, and the private school of your former medical officer of health's child why they saw it as worthy of investing in. Thank you.
Well, thank you. Any questions for the deputant? Seeing none. Thank you. To the members online, we'll need you to turn your cameras on for quorum purposes, because as of right now, we don't really have quorum. Next up is James Andrew Smith. Are you here? Online? Mr. Smith? Go ahead, 5 minutes. We can't hear you. You're on mute.
There we go. Okay. Can't seem to get my presentation up and shared, but I'll go through it regardless. So I'm here to present a Joint Health and Safety Committee perspective from York University. My background is I'm an engineering professor at York University. I'm a co-chair on the Engineering Joint Health and Safety Committee at York, and I sit on the Health and Safety Executive Council at the university as a representative for faculty at the university. The reason I'm bringing up York University as a context is because it's a very large population. So we have 60,000 members, both in terms of employees and in terms of students. We're extremely diverse, a lot like Toronto is. So we bring in students from all over the world, but as well all over Ontario. We're a commuter school. So students are constantly traveling between the university and their home locations. And from a Joint Health and Safety Committee perspective, this is concerning when it comes to measles and measles transmission. So I had to look to see what sort of documentation and communications we're seeing at the university. I had to look at our internal network, so the internal documents that we share among employees. I could only find 4 documents that referenced measles, one from 2013, one from 2018, one from 2020, and one from 2023. In terms of the public-facing network the university has, so what the public would see with respect to the communications that we have, I couldn't find anything that York was transmitting with respect to measles.
Mr. Smith, I think your internet's froze. We lost Mr. Smith.
Now, from the Joint Health and Safety perspective and from the Health and Safety Executive Council that I sit on, the only thing I could find there that referenced measles was a general policy document that we were asked to comment on back in 2023. So nothing in the last 2 years. So what are we asking for? What could we be asking for from Toronto Public Health? Well, effectively, I harken back to the presentation that was just given earlier. And this idea that there's a myth about measles being a childhood issue or a child issue. And it's not just one. It can transmit, as we all know, among the adult population and clearly in the post-secondary context. So we're looking for clear guidance for post-secondaries, the colleges, the universities, saying that effectively measles is not just for kids, and especially in a commuter school like York University, a diverse commuter school like York University, we want to see communication that's relevant to us. I would love to see coordination with professional organizations like the Ontario Society of Professional Engineers. There is expertise within OSPI on airborne disease transmission and risk mitigation methods. And so it would be great if TPH reached out to the CEO of OSPI, Sandro Perusa. And I want to reiterate here that our administration, the management at the university listens to TPH. We were told over and over again in the past few years, I'm quoting here, we continue to be guided by public health and government guidelines. Management is looking to TPH for guidance here. And so if TPH says something, management at the university will listen. And that's helpful for us working within the Joint Health and Safety Committee framework, the OSHA frameworks. So in conclusion, measles is dangerous. We know this. Measles is preventable. We know that. We also know that measles is not just for kids. And I would like to see an improvement on the communication strategies that we're seeing from TPH, especially communications that would be relevant for joint health and safety committees around the city. Thank you very much.
Thank you. Any questions for Mr. Smith? Seeing none, thank you for coming in today. Allison Kemper. Are you here, Allison? Online. Allison? Here we go. We see you. You have 5 minutes. Go ahead. Can you hear me, Allison? Allison?
Hi.
Okay.
I'm blown away by the last presenter. I am also a member of the Joint Health and Safety Committee of my university. I'm at Toronto Metropolitan. And I have many of the same points in my presentation that Professor Smith just made. As you know, universities can be enormously infectious places. We saw this last fall at Guelph, not near bailiwick, but still a matter of great concern to the province when so many of the students got norovirus and could have spread it everywhere. But I want to say that as somebody who works in an intensely crowded place, a place in which every 3 hours a new maximum capacity crowd fills every classroom, in which everybody that goes to school commutes on Professor Smith said, I work in a community setting where there's not enough input from the public health authorities to help the management mitigate the risk of measles transmission. We depend a lot on vaccination. It's really good, but it's not everything. We do not have mandatory vaccination in any program at TMU except for the health sciences. As a result, we have a higher risk than we might of intense crowding causing the transmission of airborne diseases like measles. If we thought it was a possibility with an R0 of 3 to 10, as we have experienced in various variants of COVID, it is a much greater possibility in the case of measles with an R0 of 18. I urge you to focus on the university sector in this city because of the vast number of students and staff who are in the university settings here. We're a college town in many ways. Your ability to understand community transmission and to help the public and the management of the universities understand the risks of community transmission in the university setting would be enormously helpful. When I first started teaching at TMU, I had a student who revealed that they suspected measles in the middle of a midterm exam. I discovered this and had to enact a protocol that didn't exist. We are not ready for universities to be exposed to measles. We don't have the protocols in place to prevent it or to respond to it quickly and effectively. I urge you to look at community transmission and to give management and joint health and safety committees all over the city the tools to improve our ability to prevent measles transmission in our settings. Thank you.
Thank you, Allison. Any questions from for the deputants? Seeing none, thank you for coming in. Next up is Therese Dune. Okay, 5 minutes, go ahead.
Vaccine doses listed on the immunization schedule for children, as well as the COVID vaccine. In June 2018, Dr. Anthony Fauci and the Department of Health and Human Services in the United States admitted that none of the vaccine doses the CDC recommends for routine injection into children were licensed by the FDA based on a long-term placebo-controlled trial. There were 2 clinical trials for the MMR vaccine. The clinical trial for the brand MMR2 had only 834 children for 42 days with no control group. A third of the children developed gastrointestinal issues and a third respiratory issues. The clinical trial for a second brand, Prurix, had a 6-month trial and included a control group. The control group contained the MMR2 vaccine. Both the vaccine group and the control group had a high rate of serious adverse events, emergency room visits, and new chronic diseases. Again, neither of these MMR vaccines had long-term placebo-controlled trials, so the number of individuals suffering a long-term chronic disease after receiving the MMR vaccine is unknown. That is not misinformation, it's common sense. In every case of the risk of death from the MMR vaccine and all vaccines listed on the immunization schedule for children versus the risk of death from disease, versus the risk of death from disease, the risk of death from vaccine exceeds the risk of death from disease. Children should not require an exemption for any vaccine that is known to cause an adverse reaction, especially death. Parents, guardians, and children should not be pressured into taking vaccines when they're not aware of the risks and the long-term side effects are unknown. The Journal of Pediatrics, December 1999, reminds us that the largest historical decrease in morbidity and mortality caused by infectious disease was experienced not with the modern antibiotic and vaccine era, but after the introduction of clean water and effective sewer systems. On the City of Toronto's website, there's an article titled "An Infectious Idea, Prevention of Communicable Diseases." The article reads, "Before antibiotics, the only way to recover from tuberculosis was to try to strengthen the immune system with plenty of rest, nutritious food, and fresh air. What happened to the wisdom of supporting our natural immune system?" At the beginning of 2020, I posted a comment on a mainstream media online news article about the SARS-CoV-2 virus and COVID-19 disease. My comment read, "Build your immune system, everyone." Shortly afterwards, I noticed that my comment was deleted from the site. Many healthcare practitioners and other individuals who mentioned our innate immune system or suggested ways to naturally strengthen our immune systems had their social media accounts deleted and websites taken down. After my comment was deleted, I looked deeper into COVID-19 and the concerns related to the COVID vaccine, as well as the concerns related to all vaccines on the immunization schedule for children. The well-funded forces influencing the decisions made by our government and healthcare officials will not shut down the voices or efforts of concerned parents, guardians, and citizens in Toronto. Your presentation today does not address the legitimate questions and the specific vaccine safety concerns presented to you by Torontonians over the past 5 years. Today, I'm asking the board to review all the scientific data and safety concerns related to the MMR vaccine and all vaccines listed on the immunization schedule for children. Until proven safe by experts who represent both sides of the vaccine issue, the vaccine program for children should be discontinued. In its place, programs promoting safe alternative medicines and natural ways of supporting the immune system should be initiated. Also, the CDC no longer recommends the COVID vaccine for healthy children or healthy pregnant women. I'm asking the Board of Health to immediately do the same. Thank you.
Thank you. Any questions for the deputant? Seeing none, thank you. And the final person on my list here is Skylar Hill-Jackson. 5 minutes.
Showing the book.
If you just put it on, place it on, it will come up.
That's not what I'm showing.
Turn it the other way, face up.
Oh, sorry, face up.
You're 25 seconds in.
Act like your life depends on good information, because it does. Toronto Board of Health members have a responsibility to stay current with the latest peer-reviewed studies and recent published books written by doctors and medical researchers on immunization and vaccination before, in the future, making any official response to any infectious outbreak. If board members kept current with the information available, you would know that vaccines never saved us. Death rates already dropped over 98% before toxic vaccines were pushed onto populations. Measles deaths dropped 99.96% before the measles vaccine was introduced. Improvements in sanitation and nutrition, not vaccines, were primarily responsible for declining illness rates. Healthy children do not die from naturally occurring childhood infections like measles. Malnourished children do. Vaccines are not the solution. Proper nutrition is. Did you know that vitamins A and C treat measles? Vaccination is a medical procedure which is designed to permanently alter your child's immune response. The effects of vaccination are irreversible. One mistake early on in the brain and the body of your child may be forever changed. Neil Rowe, an infectious disease specialist, and Dr. Richard Shabas, MD, Ontario's former chief medical officer, stated in a Globe and Mail October 2018 article, "Stop the hysteria over measles outbreaks. The borderline hysteria fueled by the media and public health is unwarranted." And by the way, all the children who currently experience measles now have natural lifelong immunity. While the vaccine may have been effective in eradicating measles as a childhood illness, it appears to have contributed to the significant increase in chronic health conditions in children today. Newly published by Children's Health Defense in 2025 is The Measles Book, 35 Secrets the Government and the Media Aren't Telling You About Measles and the Measles Vaccine, which states in part, vaccines are not safe for every child, and the government and pharmaceutical companies have known this for years. Some children will be injured or die from vaccines, and the government and pharmaceutical companies know this too. Pharmaceutical companies with government assistance have an incredible way to make money from vaccines and not be held accountable for injuries and death. The question board members ought to be asking is, are vaccines helping or hurting our children? Do board members have the knowledge to be able to answer that question? Remember, Toronto children could receive more than 100 doses of 18 or 19 different vaccines before the age of 18 years. To date, governments and public health authorities have failed to require vaccine manufacturers to conduct studies that prove the claims of safety, efficacy, and necessity, and prove that vaccinated children are healthier than unvaccinated children. Parents must be allowed to choose artificial immunity or natural immunity, and this should be a private matter between parents and their health care provider. No more school vaccine clinics. It is the responsibility of every parent to question everyone and everything. As a parent, our job is to do our own research, thoughtfully weighing the purported benefits of each and every vaccine against the risk of harm from the vaccine. We need to protect our babies and our children. Again, the effects of vaccination are irreversible. One mistake early on, and the brain and the body of your child may be forever changed. Where there is risk, there must always be choice and vaccine hesitancy. Thank you.
Thank you. Any questions for the deputant? Okay. I do have one question for you. How many people did the Spanish flu kill?
Sorry?
How many people did the Spanish flu kill?
Lots. But they mostly died from pneumonia, the side effect.
And polio?
Polio is a whole other issue, and I'm happy to speak to that if you invite me back.
Alrighty. Thank you.
You're welcome.
We'll take it in-house. Any questions for staff from directors? Councillor Thompson, go ahead.
Thank you, Mr. Chair. Through you to staff. You've heard the deputants, and there has been a variety of them indicating that we need to do more regarding things like public health, advocating for better air quality and guidelines for air quality and so on. And more, I'm just looking at my notes here, and more information regarding a strategy to prevent airborne diseases and so on. I just wondered whether or not the acting medical officer of health would maybe just comment on some of the things that she's heard, and what are we not doing that we could perhaps be doing more, or in fact, are we doing all that's necessary at this particular point in time, and responding to some of the comments that we've heard from the variety of deputants this morning. Thank you.
To the chair, it is always helpful to hear the perspective of the public in terms of their perception of how our efforts are landing. So what I am hearing is that our work to improve understanding of the importance of protective air quality is maybe not being perceived as very visible. So that is feedback we can take and continue our efforts to make our products and resources that are there more visible. I would say that although we can offer information and resources to other organizations, they have their own boards and governance structures, and they may make decisions about why or when they may or may not share certain resources. The second thing I would say is no question that indoor air quality is a component to health protection. And when we are in an outbreak situation, of course, our immediate focus is on the interventions that will have the immediate impact, which is why vaccination, which is an effective and safe strategy to prevent against measles, has been our main focus, as well as case and contact management. The overall improvement of indoor air quality would be a long-term policy endeavor, which we are participating in conversation and partnership with municipal licensing and standards. That work is ongoing, but it doesn't necessarily materialize quickly.
Thank you very much for that. Just a couple more questions, I guess. Can you help us, at least help me to understand, there are a variety of different types of measles. Some of the readings that I've done, there's the 9-day, the red measles, the English measles. What are the specific measles that we're facing, or a situation that we're facing here in the City of Toronto? And are there more than the 3 that I've mentioned?
So to the chair, I think some of the terms you're referring to might be some of the lay characterizations,
okay.
But we are responding to the measles virus,
okay.
And Dr. Dubé can add on to that.
Yeah, the German measles, I think, is commonly colloquially used for rubella. The medical term is rubella. So I think, but the measles is the measles that we're referring to from the paramyxoviridae virus.
Okay. And again, just to reiterate, vaccine is highly recommended by public health to protect the population.
To the chair, absolutely.
Thank you very much. Thank you, Mr. Chair.
Thank you. Any other questions from directors? I do have 1 or 2. So we have spoken about student vaccinations, and we put a lot of attention on that. Have we identified any other vulnerable groups that public health maybe can probably target, as we did during COVID?
To the chair, I'll begin, and then Dr. Dubé and Dr. Chris, who've been directly involved in the measles response, can add on. So in terms of the populations that we know that may be under-vaccinated, it is mostly unvaccinated children who are becoming measles cases in this current outbreak. So that is the reason for our focus. Older adults born before 1970 have immunity because measles was so widespread that almost everybody got it. So our focus is on under-vaccinated children. There are some adults who we caught up in the 1990s with second doses. So what we're seeing is mainly the people who are not protected are children who are either not old enough or who haven't had enough time to get their second dose. Dr. Dubé and Dr. Chris, anything you'd like to add?
Yeah, through the chair, just to say that in the Ontario outbreak, 98% of those who have had measles have been born in 1970 or later, so that is our focus. In Toronto, we have sometimes had cases among adults who were born between 1970 and 1995 because historically as a child they may have only had 1 dose of vaccine, and so dating back over a decade we have made the recommendation that they get their second dose, and so that continues to be a pseudo-vulnerable group where those adults need to make a concerted effort to make sure they get a second dose as well. But as the outbreak in Ontario has shown, 96% of the cases have been in individuals who are either unvaccinated or have unknown vaccination status. And again, most of those are born in 1970 or later.
One other population group that Toronto Public Health does specifically target is newcomers from abroad who may come from countries where the immunization system isn't as robust. So we do have scheduled clinics with settings where there are many newcomers. That focus, or the amount of activity we can do in that regard, shifts as our focus right now is our school-based vaccination program. As the school year comes to an end, then we adjust our services accordingly.
Okay, great, because my next question was about the newcomers and what steps we're taking to actually address that. And again, perhaps with newcomer kids, you could reach them through the schools, but again, just to push a little bit, when it comes to newcomers and adults, do we have ways to actually reach them?
To the chair, the way we reach them is through connection with agencies that serve newcomers. There's no central place, but newcomer serving agencies often will host clinics where Toronto Public Health staff attend. I would also just emphasize that for newcomers and for the rest of the population, the main channel for immunization is primary care. We have a large city, so we act as a secondary channel to supplement the capacity of primary care, but most people do get their immunizations through regular interactions at community health centers, family physicians, or nurse practitioners.
Okay. Wonderful. And my final question really is about the record keeping. I know that in this province, there's various ways of keeping records. Do you have any recommendations as to how we can perhaps centralize this information, not only for Toronto, but perhaps province-wide?
To the chair, I'll start, and I can see my colleagues are keen to weigh in. So, as you know, this board has made several recommendations over many years about the potential benefits of a vaccine record registry that would consolidate immunization records for every Ontarian and be more accessible to parents and patients themselves so that they can more easily know their immunization status, as well as their primary care physicians and public health. Currently, there is no one repository for that information. Many people have paper records that can easily get lost or not transferred if they change providers. And so consolidating that information in one place that's accessible to the people that could use it would be a great recommendation that we continue to emphasize. Dr. Dubé, any other points you'd like to add?
Thank you very much for that. Yes, Councillor Chang has a question. Go ahead.
Thank you. Through the chair, I'm just wondering, in terms of messaging, in comparison to COVID, what is the urgency? Because, you know, COVID, it was so serious that we locked everyone down, and maybe people have kind of numbed out to messaging about urgency. So what type of message do we have about the urgency of this measles outbreak that is happening?
To the chair, so it is urgent in the sense that measles is a serious disease. It can cause serious illness and complications, including pneumonia, brain damage, and death. So it is urgent in the sense that people need to pay attention to make sure that they are protected. The other component of risk is how likely is it that you're going to encounter those potential harms. And in COVID, everybody was at risk because we did not have population immunity. It was a brand new virus. So some of the difference between measles and the COVID pandemic is, fortunately, because we have the immunization available, we do have a population that has some immunity. What we're trying to do in Toronto is to find the pockets, the people who don't have that immunity, and give them a chance to get caught up. So it is serious, but we know what works, which is to get caught up in your immunizations. And so far, we're being effective in that, you know, with only 7 confirmed cases, even with the thousands of exposures that you saw in our city, we're not seeing transmission in our city.
It's great to hear. There is a letter to prompt vaccine record review to students this week, 140,000 of which have incomplete records. Is this letter being supported by increased availability of vaccine clinics, or are students expected to reach their primary care physicians? And we know there are many Torontonians struggling with accessing primary care.
To the chair, that is an excellent question. So of course it would be, in public health, we always try and make sure that we have a reciprocal notion that if we ask the public to do something, that we support them to be able to carry it out. So Toronto Public Health can offer some immunization appointments to catch people up. Our capacity is limited. So we do ask people to first try and get them into their primary care physician. So people who don't have a primary care physician can come to us. And in terms of urgency, we do feel like the summer is a great opportunity while people aren't in school to be able to schedule an appointment at their leisure. So we want them to pay attention. But over the coming months, they can have an appointment to get caught up. Dr. Dubé also wants to add.
Yeah, through the chair, just to also note that of the 140,000 students who will be getting a letter, some of them actually may be up to date with their measles vaccination. They unfortunately have to take that very manual process of reporting it to public health because we don't have a registry. So that's the first step, is to check to see if they are vaccinated. If they are, to take that step to report it to us. And if not, they can go to their primary care. Many walk-in clinics have this, and Toronto Public Health will be adding thousands of additional appointments as well.
Great. And so we heard about the $750,000 additional cost that has been incurred to do case management for just the 7 cases that have happened. And we don't know where this is going to go in the weeks and months to follow. I'm wondering, as these costs escalate, and we're perhaps redistributing our priorities and our funding, is there opportunity the province would kick in extra funding to support this type of case management?
To the chair, there's always a possibility. To date, we've been indicated by the ministry that they will only fund extraordinary costs for measles response to the health units currently in the outbreak region. So it does mean we need to redirect our internal resources at this time. That could change.
We're so successful that we have to pay for it. And my last question, we heard from some of the deputants about indoor air quality, and I'm just wondering what type of messaging or policy do we have when we talk to school boards about what types of filters could limit transmission through indoor air?
To the chair, we can provide them the same information that's on our website about various ways to improve ventilation. However, the actual decisions for what happens in a school setting is up to the Ministry of Education.
Mm-hmm. Thank you. Those are my questions.
Okay, thank you. Any other questions from directors? Also, too, can the directors put their cameras on as well? I do have one quick question. So people have actually approached some councillors asking about if they're unsure about their vaccination, is there any harm to getting another booster if you're unsure? Is it going to cause any harm?
To the chair, if someone has safely received a dose of measles-containing vaccine in the past, there's no concern in getting a subsequent dose. There are a small number of people, because it's a live virus, for whom they need to have a discussion with their healthcare provider about if they can receive the measles vaccine. These might be people who are immunocompromised or pregnant women. However, if you don't fall into that category and you've had a dose before, there's no harm in getting another dose of measles-containing vaccine.
Okay, thank you. Seeing no other questions, I will bring it to speakers. Any speakers on the item? Okay,
Hi, it's Trustee Lepretti. Sorry, I did have a question. I was trying to unmute, but I didn't get there fast enough.
No worries, go ahead.
So I did hear from a number of the delegations, lack of information, that they don't feel like the Board of Health is communicating properly with school boards. And as a representative from the school board, I'm wondering if we've ever considered, because we have such a good partnership with both TCDSB, TDSB, and I'm sure with the French, both of the French boards, all of the schools have websites, like a designated link, so that all of the parents could find all of the information in, just a couple of clicks on each specific school board's website. Is that something that Toronto Board of Health would be interested in, and how would we go about getting it done?
To the chair, we'll take that suggestion, and we have ongoing conversations with our school board partners. Our director, Joanne Figliano-Scott, who engages most directly with them, may be able to provide more details about how we could pursue that conversation.
Through the chair, we do meet with the school boards regularly, routinely with all 4 school boards, and we bring ongoing health issues to them for their attention. We point them to resources and our communication materials, including our toolkits. Because we do meet with them regularly, we can bring this feedback back and discuss different ways of sharing information that would make the information more accessible to students, staff, and parents.
Amazing, great, thank you.
Thank you. So we'll go to speakers. I see none, so I will start. I do have a motion. So it's a 2-point motion, and they both request to the Ministry of Health. The first one being to, here it is. Actions to understand the reasons for vaccine hesitancy is the first point here, and second, to action to address vaccine-related malinformation, disinformation, and misinformation. And the second point, number 2, is really a request we've always made to the province, and we'll do it here again, is to request to consolidate electronic vaccine medical records with public health records. Again, this caused a lot of confusion and problems, and people do move from one city to others across borders, and so it's important to have this information available wherever you live, and I believe in Ontario, and perhaps even across Canada. So that's another request to the province as well. Any questions on the motion? Seeing none, okay. Any other speakers on this item? Seeing none, okay, so we'll move to the vote. All those in favor of my motion? Any opposed? Carried. Item as amended? No? We don't need item as amended. Okay, so that's good. We're going to item number 2. HL 25.2. 1 second, where am I? Oh yes, so we're actually going to item number 3 because we moved item 2 to the end. So HL 25.3, 2025 Toronto Urban Health Fund Allocations and Review Process. We have no speakers, no deputants at this time, so we will move it to any questions of staff. Somebody held it, right? I did. I just have a motion. Oh, you just, okay. So seeing no questions, we'll go to speakers. Councillor Chang, go ahead.
Thank you. I have a motion that I worked on with staff, and that is that the Chief Medical Officer of Health consider including intimate partner violence and vaping as priority areas for the Toronto Urban Health Fund as part of the review of the program that is expected by the at the Board of Health in Q4 of 2025. And this is to support the declaration of IPV as an epidemic. We know that it's impacting community members across our city. And in addition, you know, I hear from so many residents and parents in particular, the impact of vaping is having on our young people. So I think that these are areas of concern and hope they can be considered as we think about the future funding opportunities. Thank you.
Thank you.
Mr. Chair?
Go ahead.
Just a question for Councillor Chang. I'm just wondering if you would consider this as a friendly addition or amendment to your motion. I'm just curious about the use of Red Bull, the drink. Mm-hmm. I have a resident whose son died on his first use of this particular product, and just been thinking about this as an opportunity for public health. Maybe just, I don't know if they've ever actually taken a position on this. I just thought that perhaps if Councillor Chang is amenable to it, I'd like to add this as an element for them to consider as well.
Mm-hmm. Yes. So I think I'm happy to include youth consumption of energy drinks, because I think that is also something that is very concerning and a trend that we've seen rising. So happy to hear that. Yep.
Yeah, wonderful. So we'll make that change. We'll go to the vote since we...
Actually, while we're editing it, can we just add the word youth beside vaping?
Okay.
Thank you.
And also, too, before we vote, we need members to turn the cameras on for quorum purposes.
Can members participating online please turn their cameras on for quorum?
All right, we have 7 members on screen. So there we go. All those in favor? Opposed? Carried? Oh, Lord. The item as amended? Because they're motions. Item as amended. All those in favor? Opposed? Carried. Wonderful. And the next item is item 4, establishing the City of Toronto's Mayor's Award for Artificial Intelligence Innovation within city divisions, agencies, and boards. Any questions of staff on this item?
I do, Mr. Chair. I wanted to ask about existing guardrails from the public health management perspective, less from the sort of youth technological piece use. Does Toronto Public Health have a policy framework for governing the use of artificial intelligence currently? And just have any parameters been set for TPH staff on what AI can be used for within their work and how it should be used, et cetera?
To the chair, currently Toronto Public Health does not have its own policy on the use of artificial intelligence. We are aware that the City of Toronto as a corporation is working on a policy specific to artificial intelligence. But in general, there is a corporate acceptable use policy that covers instructions on how employees engage with devices and software in general. And we actually have here our Chief Information Security Officer who can also provide additional details.
Thank you. My next question has to do with how, in terms of the current practice of TPH staff using AI, has there been direction for that to be done according to the best practices for AI identified by ALPHA, Association of Local Public Health Authorities, and the provincial and federal governments, which have taken a closer look at this?
Chair, Manish Agnihotri, the Chief Information Security Officer. By the end of Q2, the CISO's office, with collaboration with the Chief Technology Officer and SIMS and Legal, will have an AI governance framework in place. And that will be a governance board that will look at AI use cases throughout the City of Toronto, working with divisions, agencies, and corporations. And through that governance process, we will look at each case to make sure that if AI is being used, things like biases and PII data risks are mediated before that use case gets approved.
Thank you so much for raising the question of bias, because as we know, artificial intelligence is only as intelligent as the information that it's provided. And we've had lots of evidence over time that it can be quite sexist, racist, make assumptions that are problematic. So my question really has to do with whether you agree that for public health, which is focused on social determinants of health and reducing health inequalities, it might be helpful to have specific use cases that would require that we have specific use cases that might require additional guidance or specific guidance on like other parts of the City of Toronto and the public service?
To the chair, I think with my colleague, the answer would be yes. And the specifics that we have to pay particular attention to is our statutory obligations in terms of protection of personal health information under PHEPA and as it interacts with MFEPA. So yes, we've already been in some conversations with the Office of the CISO, for example, on some specific cyber security awareness training that we would like to develop in concert with them because of our unique needs as a health information custodian.
Okay, thank you. I'll be moving a motion to follow up on this question. Thank you.
Thank you. Any other questions to staff on this item? Seeing none, so we'll go to speakers. Councillor Bravo, you're up.
Thank you. So as I indicated, I think that we have to, any technology is
sorry, you have a motion, Councillor? You have a
yes,
motion?
I do.
Okay.
Sorry, I do have a motion. I apologize. I'm doing what I, yes, thank you very much. So my motion is to direct the medical officer of health to report back to the Board of Health in the third quarter of this year. This would coincide with following up with the acceptable use policy that the chief technology officer, or whatever that, sorry, I got your title wrong, has just indicated, with AI guidelines that would, and if needed, like the supplementary pieces that would help for public health governance in terms of staff use, how we're collecting data, or making sure that we don't have any biases or inaccurate information as part of the process, and that it is in line with Association of Local Public Health Authorities and provincial and federal work that's been done around AI governance and use.
Okay. Thank you. Any questions for the mover? Seeing none. Any other speakers on this item? Seeing none. Okay. So we'll bring the motion back up on the screen. All those in favor? Opposed? Carried. That's it, right? Yeah. For number 4. Okay. Yeah. All right. So the next item, Directors, we have an item that requires a closed session. I will move a motion for the board to go into closed session for item 25.2. Displaying on the screen. Okay, all those in favor? Opposed? Carried. I'll ask the board secretary to temporarily close the meeting to members of the public and to only provide access to directors and appropriate staff for the closed session portion of this meeting. In addition, the YouTube live stream will be suspended until the closed session is over. Directors, I would also remind you to arrange your surroundings so that no other person observes any part of the closed session debate.
Hello, everyone. This is the board secretary from the city clerk's office. I'm going to read a statement for those that are connected remotely via WebEx. So the board is now going to move into closed session. So we will first be suspending the live portion of the live stream. We will then, we would like to ask that anyone who is not needed for the closed session to please leave and rejoin. You can reconnect using the same meeting details that you used at the beginning of the meeting. They are also published with the meeting's agenda at toronto.ca/council, or you can email the city clerk's office at boh@toronto.ca, and we can work with you to re-establish your connection. So the WebEx recording is being suspended. Just a reminder to anyone in the committee room that is not needed for the closed session to also please exit the room. Members, kindly please do not begin any discussion until we advise you.
Okay. So I think we. But yet they're penalizing us on the CS stuff. Okay, we are now back in public session. The board will now consider publicly each of the items considered in closed session. So we have one item. Oh, yes, right. We have to go back and reopen item 3 for recorded vote. So I'll move motion to reopen. All those in favor? Opposed? Carried? Okay. So recorded vote on item 3.
I have to move my motion again? Okay. In favor? Okay.
So on Councillor Chang's motion, Councillor Moyes, how do you vote?
In favor?
Councillor Bravo?
In favor.
You can take it down.
Okay.
Okay, sure. Abinaya?
Edited.
Chandra Ralaban?
Let's try that.
Sorry, Abinaya, how do you vote? In favor. Councillor Chang, how do you vote?
In favor.
Lindsay Kreshner, not present. Ida Lapreti?
In favor.
Charles Azud, not present. Councillor Peruzza? In favor. Suman Roy? Not present.
Abstain.
Yes. Okay. You may want to close, just turn off your camera. So Suman Roy, not present. Ramanjit Singh, not present. Councillor Thompson,
In favor.
in favor. Stephanie Dow, not present. Okay, motion carries.
Do I adjust it? Okay, motion as amended.
Councillor Moyes, how do you vote?
In favor.
Councillor Bravo?
In favor.
Abinaya Chandrabalan? Councillor Chang?
In favor.
Lindsay Kreshner? Not present. Ida Lapreti?
In favor.
Charles Azud? Not present. Councillor Peruzza? In favor. Suman Roy? Not present. Ramanjit Singh? Not present. Councillor Thompson?
In favor.
In favor. Stephanie Doe? Not present. Motion carries.
All righty, thank you. And the last item is item HL 25.2, Downtown Homelessness Addiction Recovery and Treatment Hub. All those in favor of receiving this item? Opposed? Carried. Sorry. All those in favor of... I do have a motion. Oh my, I'm just trying to run through this, that's why. I do have a motion for this item. It's on the screen. It's directing the Deputy City Manager to Emergency Management to convene an outreach and case management or coordination table comprising relevant city divisions and agencies to streamline pathways into program and services and monitor outcomes. And there's also number 2 here as well. Directing the MOH to report back to the Board of Health in the 4th quarter of 2025 the status update on the implementation of the Downtown Homelessness Addiction Recovery Treatment Hub, including work to finalize indicators for reporting on the performance of its programs and services. Okay, any questions of anyone? Seeing none. All those in favor? Opposed? Carried. Item as amended. All those in favor? Opposed? Carried. And that takes us to the end of our meeting. Thank you so much, everybody.